It's our pleasure to welcome everyone and good afternoon from Thailand. Good morning from for people who are from Africa, and perhaps good evening if we have participants from like down south Australia. We would like to welcome you and everyone joining us today. I am Dr. Saranya Sucharit-Pong from Institute for Population and Social Research at Mahidol University, and I have the pleasure of serving as your MC for this webinar. Today's event is titled Taxing Food, Feeding Change, Research Insights in Physical Levels in Food Systems and Nutrition from National to Global. This is our second webinar in ongoing series, the Asia Africa Learning Exchange in Food Policy Research and Advocacy, which brings together researchers and practitioners from across regions to share evidence, experiences, and lessons in advancing healthier and more sustainable food systems. Let me briefly walk you through today's schedule. We will start with a 10-minute presentation by Assistant Professor Pojana Hanjangsit on title Thailand's Sugar and Sodium Tax Policies. This will be followed by 20-minute panel discussion featuring Assistant Professor Pojana Hanjangsit, Dr. Nisha Arun Chilek, Professor Amos Lar, and Dr. Gershim Asiki. And the panel discussion will be moderated by Ms. Madiha Ahmed from International Development Research Center, Canada. After the panel, we will have a 15-minute session on learning from international experts working on fiscal policy globally, with insights from two international experts, Professor Lynette Bierman and Dr. Sholatan Virudwong. Finally, we will open the floor for Q&A and closing remarks from 2:50 to 3:30. So allowing time for all the participants for discussion and reflection on key takeaways. So before the Q&A, if you have questions or comments, put your question or comment in the chat box and we will take that during the Q&A session. So without further ado, let us begin. It's my pleasure to introduce our first speaker, Assistant Professor Pojana Hanjangsit from the Institute for Population and Social Research at Mahidol University. Dr. Hanjangsit is an expert in health demography and cost-effectiveness analysis, and she has recently led studies assessing the physical policy impacts of taxes and other interventions on unhealthy foods and sugar-sweetened beverages in Thailand. Today, she will share her insights on Thailand sugar and sodium tax policies. Yeah, please join me welcoming Professor Hanjangsit.
Thank you, Dr. Saranya. May I share my PowerPoint? Okay. Thank you. Could you see that? Okay. Okay, today I will share how our research in Thailand has contributed to informing national nutrition policy through fiscal policies such as taxes. And I will start from why fiscal policies in food system, and then follow with taxing sugar sweetened beverages, sodium tax, and saturated fat tax, and then lesson learned and the progressions of timeline of Thailand's new physical nutrition policy, and end up with the conclusion and looking ahead. You may have questions that why physical policy in food system This is because we are facing the growing in diet-related non-communicable disease, and this occurs not only in Thailand, but I'm sure also in many countries globally. And we may not reject that individual choice is influenced by market forces, and physical policies are systemic interventions that can nudge behavior at the population level. Of course, to implement any policies need a strong evidence. And I can say that physical levers act as invisible hands to shift diets and improve public health. Let's we move to the research that we are finished. It's in taxing sugar sweetened beverages. We estimated the health impact of SSB tax from phase 1 to phase 4. The phase 1 has been implemented in the year 2017 until right now in phase 4, 2025. And we model reduction in obesity and type 2 diabetes mellitus, cardiovascular disease, and other NCD. And our result directly used by the excise department for SSB tax through phase 4. And here is some our result that we found that if we implemented the SSB tax until phase 4 or at this moment, we found that the obesity type 1 and type 2 will reduce around by 4% and 8% respectively. And if we model for the first 17 years for the health benefits, we can see that the most cases of disease avoided is from type 2 diabetes and 3,500 from type 2 diabetes that death can prevent it as well. And for economics, we can see that the government will save the healthcare cost around 31 million US dollar. And this can generate the tax revenue around 94 billion. And let's move to the other ongoing research for the sodium tax that we model the potential impact of sodium tax that we estimated the reduction in sodium intake and hypertensive burden and cardiovascular disease and chronic kidney disease prevented. And we collaborated with the LESOL Network, Excite Department, and the WHO in Thailand, Ministry of Public Health, and Thai Health Foundation. And this aim to inform and advocate national sodium tax policy. And here is some our preliminary result that we can see that if the industry can reduce the sodium content or reformulation as the criteria that we use in Thailand, we can prevent the hypertensive cases around 119,000 hypertensive cases. And if we implement for first 15 years, the health benefits, we can see the most incident cases prevented from stroke, around 119,000 cases. And from the death prevented, we can see that it's the most is from stroke as well, around 15,000 deaths that we can prevent. And for the in terms of the economics, the government would save the healthcare cost around 194 million US dollar. and this can generate the tax revenue around 1.8 billion US dollar. And let's move to another ongoing research is about the saturated fat tax, that we estimate the reduction in saturated fat tax intake and CVD burden. And we corroborated work with Ministry of Public Health, Excise Department, and Thai Health Foundation, and this aim to inform and advocate national saturated fat tax policy. And the lesson learned that I can share that is sometimes good evidence does not lead to policy unless there is momentum, timing, and the right framing. And I would like to encourage researchers and policymakers to work together to co-create practical solutions. And here is the progressions for the timeline in Thailand for physical nutrition policy that we started from SSB tax from phase 1 to phase 4 from the 2017 until right now. And we have the sodium tax policy driving committee since 2024 or last year and until now. And let's see that in the future that we will have the saturated fat tax. And in summary, I can say that physical tools are powerful public health instruments, and research has played a central role in shaping Thai nutrition policy, and Thailand case shows the power of evidence-based advocacy. And therefore, I can say that with the right timing and partnerships, science can fuel structural change. Thank you.
Thank you so much, Professor Han Jang-sit, for your insightful presentation. We learned a lot from what Thailand has been doing and the ongoing activities. So let's now move to our panel discussion with 4 distinguished experts. Of course, Professor Han Jang-sit will still be with us in this panel. Next, we have Dr. Nisha Arunatilek, Director of Research at the Institute of Policy Studies of Sri Lanka. She is also a research fellow with the Partnership for Economic Policy. The third panelist is Professor Amos Lar, Professor of Public Health Nutrition at the University of Ghana. His work focuses on food environments and NCD. The fourth panelist is Dr. Gershim Asiki, research scientist at the African Population and Health Research Center in Kenya. He's leading the NCD research program at the research center. This panel discussion will be moderated by Ms. Madiha Ahmed from the International Development Research Center, or IDRC in Canada. I now hand over the discussion to her.
Thank you so much. So this looks to be a very exciting segment. We'll be sharing experiences and lessons from Ghana, Kenya, Sri Lanka, and of course, Thailand. First, let me thank the panelists for taking the time to be here. We really appreciate it. I know it's lots of different time zones are in play. For my first question, perhaps I might turn to you, Gershim, and ask about the Kenyan experience. As Pojana was sharing, there's increasing consensus and literature on the role of SSBs and fiscal policy for reducing unhealthy diets. And we've seen SSB tax rollout increase to nearly 100 countries or more. But can you briefly explain the ways in which the Kenyan approach has been different, particularly, for instance, what Pojana was explaining has been the Thai experience?
Thank you, Madiha. Hi, everyone. I'm from Nairobi, IDRC. I happen to sit in the technical committee that is developing the tax policy in Kenya. and I lead the research supporting that work. I'll share my experience based on what we have done in the technical working group. Our approach is different in two ways. One is in the naming of the tax. The second difference is we are using a nutrient profile model. I'll explain this further. We have preferred not to use the nutrients in the naming of the tax, say sugar tax, sodium tax, or fat tax. We prefer to call it a health promotion levy. This is to allow us carry the public along with us because there's a negative perception of taxes. I think this is happening in many countries, that the public is averse with introduction of taxes. And we feel we should name the tax in a way that actually carries the public along with us. A health promotion levy would emphasize the fact that this tax will prevent NCDs. And secondly, the revenue generated from the tax, part of it can be used to support health programs. So that is the basis of that naming. But then the second aspect I mentioned is the nutrient profile model. Unlike other settings where a food group is labeled as unhealthy and is taxed regardless of the content of the nutrients in them, we prefer to use a nutrient profile model, which is a tool that classifies foods into healthy and unhealthy based on the contents of salt, sugar, and fat. So in Kenya, we're very particular about that, and we think this will actually promote reformulation. And also the industry, if you choose, say, sugar-sweetened beverage, the industry could quickly say, why are you only singling out this food group when there are other food groups which are unhealthy? But now when you use a scientific tool, which really classifies, you might find that some of the sugar-sweetened beverages might have actual thresholds of sugar less than what is recommended. Therefore, it's unfair to classify them, give them a blanket term as unhealthy. Thank you.
Thank you so much, Gershom. If I may actually use this to shift our focus to Sri Lanka, so I will direct this question to you, Nisha, in the Sri Lankan context, there has been some work on SSB taxation, but in general also fiscal policy. Do you feel, given your experience and your research in this area, this is a good starting point for improving competitiveness of healthy foods? Nisha, you are still on mute.
So, yes, definitely. We recently conducted a discrete choice experiment in Sri Lanka to evaluate how consumers make beverage choices in the presence of multiple product attributes. You know, they don't only look at the prices, but they look at the type of beverages and the labels which give them information. So they look at all of these when making beverage choices. And the results of this study indicate that a combination of policies is necessary to encourage consumers to make healthy choices. And among these taxes on unhealthy food plays a crucial, is very crucial because especially for disadvantaged groups, the poor and the young, they are very price sensitive. So even when, what we found out is, even when, because in Sri Lanka, we also have traffic light labeling, and red means the food is not healthy. So even when they know about this labeling and when they know that a food is unhealthy, they still prefer to buy the red labeled beverage because it is cheaper. So it is very important that you couple these other policies with taxes, because that really encourage, because at the end of the day, but especially in countries like ours, where there are large populations are still low income, this price plays a crucial, it's very crucial. So I think these taxes are very important because of that. I will put a link to our study so you can read more about it.
Thank you so much, Nisha. If I may actually move to Amos and his experience in Ghana. Specifically, Amos, I wanted to speak a little bit about what you and your co-authors published in 2023 in the BMJ about making food-related taxes palatable in sub-Saharan Africa. Could you speak to us a little bit about that? Because all of the other speakers have also mentioned how important it is to create coalitions and support for change.
Thank you, Madia. Exactly. So your question invites me to talk a bit about Ghana's recent, food policy reform efforts, especially our health tax. That initiative moved Ghana from debate to delivery on SSB taxation after years of groundwork, as you noted, civil society working with researchers and other actors. And so in the paper that you refer to, we summarize these experiences. In the paper, we articulated, that the Ghanaian experience reflects both challenges and, a promise for food policy reform in an era where diet-related morbidities are rife and rising. And so globally, not only just in Ghana, but globally, as we have heard from Kenya and Thailand, and other places. Food policy philosophy now is shifting from interventions that focus exclusively on individual responsibility to collective or structural accountability. And so our effort in Ghana to push our government to enact a tax that protect, promote, or support health was in line with that philosophy. We do know government have a responsibility to protect health, and we supported the Ghanaian government through that advocacy and research to do that. As we did that, we asked them to, in addition to coming out with a tax, earmark some of the funds. And crucially, to support this, we did a national survey that involved nearly 8,000 Ghanaians, and then about 66% of the participants were supportive of such a policy initiative. But when they became aware that funds from the policy could be ring-fenced for public health interventions, the support even went higher to 77%. Unfortunately, and then at the same time, unfortunately, we got the tax passed, but we didn't get the earmarking. But the civil society group with public health professionals continued to fight, continued to advocate. And so in January this year, January 2025, a new government came into office with a health-facing, manifesto. And then the conversation shifted from no earmarking to either soft earmarking or hybrid earmarking. And so that then led to a Ghana Medical Trust Fund that is affectionately referred to as Mahama Cares, named after the initiator of the fund, that's our president. And so it's a landmark initiative. The fund covers costs of care and medications for NCDs that are not currently included in our national health insurance scheme. Aspect of the funds would also be used for health infrastructure equipment, but most importantly for me, research in this space. And so a task force has been inaugurated to operationalize this. And for us as public health professionals and advocates, what we are advocating for now is getting Mahama Cares aligned with clear reporting, equity safeguards, and then measurable output. That is how a tax then becomes trust, as in the name, but then trust also becomes health. So that is our experience in this space.
Thank you, Amos. I'm always inspired and motivated by the progress and the speed with which Ghana is undertaking reform and policy reform. We hope that through this exchange, other countries also take motivation and inspiration from this. In this case, perhaps I might actually turn to Dr. Pojana and ask, Amos was just sharing about how important that survey was to get a sense of what the public thought about this policy approach. Can you share with us a little bit about your experience with the large-scale food industry in your research and policy discussions, perhaps in the design of the sodium tax, etc., and how that compares with perhaps consumers and the public?
Okay, thank you, Madiha. I may not have the direct experiences with the large scale of food industry. However, I have also conducted the qualitative research that we in-depth interview from one representative from the instant noodle and one from the snack company. And we also did the focus group discussion in the general population for the whole country for 5 regions in Thailand, including Bangkok. And you may guess that what it will be, right? Because the food industry, they will complain a lot and have the argument that why they have to reformulate or reduce their sodium content. And in the last few months, I have a chance to join the workshop we call design thinking that organized by the excise department, that they gather the stakeholders, all stakeholders, including the industry food company and academic persons and all stakeholders to discuss that what the criteria that we will use to implement or apply for the sodium tax, and what the tax rate that it would be implemented in the sodium tax. Yeah.
Thank you. Actually, this is relevant to, I think, some of the experiences that Sri Lanka has to share. So Nisha, I will perhaps ask you about this. Sri Lanka has excellent experience and has taken strong action towards taxing alcohol and tobacco. And so you are very familiar with opposition that can come from certain segments, while other parts of society are very supportive of these measures. So as Sri Lanka looks to expand SSB and other taxation on healthy food, what are some of the challenges that you're facing in doing so?
Yeah, so actually today in the morning we had a stakeholder meeting because as part of the Shape Asia initiative, we are trying to promote taxing unhealthy food and all of that. So we have a very good experience with the National Authority on Tobacco and Alcohol. I think not very many countries have that. So it is a government authority, but it was specially implemented when the Framework for Convention on Tobacco Control, when we signed on that convention to actually handle the control legal aspects for alcohol and tobacco prevention. So NATA is responsible, that is the National Authority on Tobacco and Alcohol, formulating and monitoring the proper implementation of policies aimed at controlling tobacco and alcohol. So they establish, like, for example, free trades, tobacco-free zones, or formula for increasing excise taxes. They would, on tobacco, they would promote those things and bring different stakeholders together to promote advocacy. So we feel actually because this authority is there, they are able to take action. And what was discussed today in the morning among the stakeholders is that at the moment, the Ministry of Health is doing something similar, but it is mainly doctors, but you need different stakeholders because NATA involves lawyers, sociologists, psychologists, all kinds of people are brought together by NATA to take preventive action. And we feel that you need these kind of multi-sectoral approach for prevention because it really involves legal aspects, social aspects, all different types of things. So it is not something that the Ministry of Health alone can do. So that is the experience, and it has been very successful. We've been able to bring down tobacco and alcohol control. So I think that is a good experience for sugar sweetened beverages as well.
Thank you so much, Nisha. I might pivot from this and go to Gershom, because you spoke a lot, of course, of your technical role and how you work normally. But perhaps if I may ask a cheeky question, what is a key lesson in your work, both in Kenya and other countries, in other work that you've done in economic modeling in East Africa? What is a key lesson that can sometimes be overlooked by researchers when working on fiscal policy and food policy?
Thank you. A key lesson for us is that you should have everyone on board as they're developing these policies, the public, the politicians, and the policymakers, which is in line with the kingdom theory that the three streams, policy, problem stream, and the politics should converge in order to have a policy window. I'll give you a typical example of what happened in Kenya. We concentrated on developing the technical content of the policy for unhealthy food taxation, the health promotion levy. But actually, we didn't concentrate initially much on the public sensitization, because our understanding was that the government that came in power in 2022 had a very positive aptitude towards taxation, because they wanted to expand the local tax revenue through taxation. And therefore, the buy-in from government was not a problem. Actually, the Ministry of Health was very positive about this. We talked to the Treasury. But then one aspect that we did not concentrate a lot on is the public. So it so happened that in 2024, the Parliament was trying to pass a bill to increase taxes on various products, including foods. And that actually attracted an outrage from the youth, to the extent that they attacked the Parliament and banned part of the Parliament. So the policy had to be recalled. I mean, the bill had to be recalled. And therefore, we also had to slow down the pushing for the healthy tax policy, because there was now a lot of negative publicity about any form of taxes. So really the lesson is that much as we're concentrating on the technical aspects of designing the tax, we need to carry the public along with us. And in fact, we're now designing a public opinion poll to look at how the public perceives various taxes, including the taxes on unhealthy foods. Just like Ghana, we are actually planning to roll out 4 policies at the same time. So we're going to get the opinion of the public about the 4 policies together and look at acceptability, their understanding and awareness. And happy to learn from Ghana actually that 66% supported the policy. So maybe we'll also benchmark on that and look at some of the tools that are used and some international tools that have been used for public polls to understand this. And then this will shape the advocacy efforts. We're working with advocacy partners, civil society organizations in Kenya, who are actually educating the public and also pushing the government to implement these policies. So after this poll, we should be able to strengthen their advocacy efforts to increase public awareness and acceptability of this before we actually push forward this tax. Yeah, thank you.
Thank you so much, Gershom. I had lots of questions, but we are running out of time. So maybe I might ask one last question of Amos. Amos, we've been talking about coalitions and collaborations. Something that Ghana has done really well is even in your research development, it's been co-created with policy partners and government officials. Can you speak to us very briefly about your experience in doing that?
Yes, thank you. So one of the grants that IDRC funded named Meals for NCDs. Indeed, Gershom, who just spoke from Kenya, we contributed to implementing that. We've been collaborating for years. And so when we were writing that grant, we worked with Ghana Health Service. Ghana Health Service is an agency under the Ministry of Health for implementation. And so usually researchers will write a grant and name themselves as investigators, principal investigators. In this case, we innovatively introduce them as implementing investigators. And when we implemented that project, together, we designed and implemented the project together with them. We learned a lot that it is easier to get findings from such co-created projects into policy compared to researchers just generating their data and then taking them to the policymakers. So that's one big lesson we learned. The other lesson we learned, apart from just collaborating with the government, was working also with civil society. And so as researchers, we do best in generating evidence, but communicating that evidence is a challenge. And so we came together to form a coalition. We actually refer to it as a coalition of coalitions, because you have a coalition of academics, a coalition of civil society, then working together to generate evidence. And the evidence is used for advocacy, but not just also advocacy where researchers are not involved. The advocacy here is evidence-informed advocacy. So we have learned that it's really important to build those coalitions and then use them to push some of these agendas. Thank you.
Thank you so much. I'll just do a quick thank you to all of our panelists. Thank you so much for your time. Let's move on to the next session.
Okay, so the next session, we will be hearing from two experts on special learning space who work on fiscal policy in public health. Our first expert is Dr. Cholatan Visaruwong, an economist with the Fiscal Policies for Health Unit at WHO, working on health taxes, including those on tobacco, alcohol, and sugar-sweetened beverages. Dr. Visaruwong has over 20 years of tax policy experience, covering all major excise products. Joining her is Professor Leonard Weirman, Professor of Public Health at Griffith University, Australia. He leads the Public Health and Economics Modeling team, and his work focuses on health economics, disease modeling, and the cost effectiveness of prevention policies. Together, they will share their perspectives on how fiscal policies can be powerful tools for improving public health. First, please join me welcoming Dr. Visaruwong. Dr. Visaruwong, can you turn on the mic?
Morning,
Yes.
good afternoon, and good evening, everyone. Let me share my screen. Or you will present it, or should I share it?
Yeah, you can share your screen.
Okay. Screen is work. Okay. Can you see my screen?
Yes.
Hello? Okay.
Yes. Yeah.
Okay. The topic that I want to talk is the fiscal policy taxing on food. And a lot of people that already mentioned on the food tax and sugar sweetened beverage tax. But one thing that I want to make it people clear about when we're talking about why we're talking about the tax and the health. Actually, the tax on certain food and products is happening for excise tax, which is a specific tax on consumption certain good. But most of the tax on excise long time ago is just for revenues. So when the government collect it, it generates revenues. But just recently in the last 10, 15 years, the excise tax become more important as a health tax, because we want to use the excise tax to target on certain products to improve health. And that's very important. It's not just for revenue, but to improve health. Why is related to the health? Dr. Pochana already mentioned because of some of the death that happening in the world right now, global death, 41 million a year is happening by the NCD, which is a non-communicable disease. Some people may not know what is NCD, but the NCD is the major risk of the death in the world right now, not just, and it's not passed by infected to the other, but it's just come from your behavior risks. And that just come from the consumption on certain goods like tobacco, alcohol, unhealthy diet, and non-physical activities. It's become a major risk for NCD in the world. And this 41 million death is happening for the premature death of 15 million a year. 86% of this is actually happening in the lower middle income country. So it's become urgently to try to curb or prevent the NCD. And fortunately that the tax is one of the best buy interventions that's happening in the population level. And when you're doing the tax, it's impact everyone. But at the same time, you can choose not to consume this product and you don't have to pay tax. If you consume more, then you pay more tax. So this is something is a kind of physical tools or economics tool that intervene through something we call the price. And the other thing is that this NCD that cause the death and disease also increase the healthcare costs and reduce the productivity of people in the world so much. Right now, the cost is on average is about 2% of the GDP. It is keep going up. So how the fiscal policy that's work to track and subsidy health in terms of promoting health actually is work through the price. Okay, in terms of subsidy is reduce the price because of government support on that. And in terms of the tax is disincentive to the price that make the price increase. Okay, so this is like a two engines that the government can be used through the fiscal policy to promote better health or healthy diet. It make the unhealthy product become more expensive and make the healthy product become cheaper. That is very key because if you increase the tax on even SSB or in terms of the unhealthy product, but the price is not relatively increased, it's just generate the revenues to the government, but not impact in terms of changing consumer behavior or producer behavior. Because of the price that the government intervene here is through the something that we say externality and internality that happen to the cost of these products, not just harm to the person who consume it, but also to the society. And the tax work into of make this price reflect the true social cost. And so it's not remove or restrict the choice, not like banning or regulating, but it's worked through the consumer choice through the price and make the unhealthy choice become more expensive. So for people who work on the fiscal policy here, when you're doing the health tax or the food tax or the salt sugary drinks, when you tax on it, you need to make sure that the tax pass through the price. In here, we're talking about relative real price. And over time, there will be inflation and also the price change and also the income growth. You need to make sure that the tax is high enough to make the real relative price of this product become more expensive. And so people will reduce the consumption of the unhealthy product. If you increase the price not so much, it may generate more revenue. It may generate the chain of reformulation of the product, but it's not going to reduce the consumption because the price is still the same, okay? And maybe even cheaper or more affordable. And this is how the tax work. The tax increase is the cost at usually for excise is implement on the producer and the importer. So they shift up the cost into the price to push the burden into the consumer. And this is when I'm talking about the tax pass through the price. Need to check and evaluate on that. If the tax is not increased high enough, usually the price may be reduced or not increased at all. And the price should be increased high enough to make the affordability of this product become less. And that's why it's make the consumption to reduce. If this not go through the affordability to be reduced, the consumption will not reduce. And if the consumption reduce, that make the NCD and the DDC reduce, that improve the health. That's the first win. then people become more productive, and then the healthcare costs become reduced. The second win is the government gets more revenue. And the last one is that it's reduced the inequity in terms of the health inequity, because of this impact of the price impact the poor more than the rich. So it's because it's a win-win-win policy. And recently in July, the WHO raised the 3x35 initiative as a bold global effort to urge the country to raise the real price of these three products. Either one of them at least 50% by 2035, 10 years, decade, to reduce this, cut the cost of this product, and also raise the revenue. And we crunch the number. If everybody doing this, you will get at least US of 1 trillion in the public revenues in the time that domestic resource is very scarce. So health tech is one of the good options. This is the detail of it. I will not go into it. So recently, the lots of country has been using the excise tax as a health tax. And in terms of for the food and SSB, as you can see from GIFNA, right now SSB tax has been 115 country implemented in national level, and also sub-national level into two place. And for the food tax is 41. Okay, so it's keep growing up, that more country implement this tax. And this is an example of which country is already implement. And for Kenya, colleagues already mentioned that for now, most of the food tax is targeting on certain group of products. And more study using not nutrient profile model to target a certain group of products. But the same thing, you need to be balanced, because of if the tax is across the board or broad on certain a lot of goods, it's also impact into the cost of living. So for right now, that you need to balance between the two, and then based on the nutrient profile model or nutrient information to target a goods that been taxed. Right now is 41 country. The recent one is on the Mauritius on October 1st, just start to tax on ice cream based on the sugar content. There are also some kind of food subsidy that recommend in some country also, which is like mostly in the term of food voucher, food distribution in India, and also in European country or country that use multi-rate of VAT also start to use the reduced rate for the healthy food to be, promote the healthy food become more cheaper. And for the food tax driven by the health considerations, there are 3 countries right now that target on the unhealthy products. Hungary is the one who used the nutrient profile models and look at the sugar, fat, and salt and set up the threshold to tax on a group of products. Colombia is another one, but focus on ultra-processed food. That means how much the food has a lot of processing and they have high content on sugar and sodium and saturated fat. Mexico right now tax based on the non-essential food based on energy dense, but the tax on ad valorem. So this is growing, but still quite limited in terms of the number of countries that target on the food, but more in SSB tax. So when we decide on the tax for food or healthy promotion, you have to set the priority. What is your target? And what kind of product, which can be based on nutrient profile model, or we can based on the country context itself. And then what type of excise that you want to apply. Some country use ad valorem, some country use specific, some country use mix. Like Thailand use the mix, and Kenya use ad valorem. For ad valorem, do you use it as a ex-factory price or you use a retail price? When you use a specific, you use as the volume of the per liter, or you tax is by the sugar content. So all this is involved with the tax become uniform or tiers. The good example of the SSB tax that used by tier is like UK, that have the like a ladder of the tiers, that if the sugar content is higher, you are taxed more. And what is the rate of the tax should it be? If the tax, as I say, if the tax rate is very low, you have to check the tax pass-through, whether the price change or not. And if the price change, it change enough to make the product less affordable or not. Otherwise, at the end, you may not reduce any sugar consumption, okay? Because of income growth and also inflations make the tax become more affordable over time. And the last one is that, do you have tax administration capacity to implement it. For example, if you want to tax based on sugar content, do you have a laboratory or the certified lab that enough to check on this? Do you have a random check or validate whatever the taxpayer declare their own sugar content? This is something that need to be prepared. So for this, I say that the tax for healthier diet become more important, and it need to be combined with the other interventions like labeling, regulations, market restriction. It's a multi-sectoral interventions. The tax itself is not going to be only one can win everything. You need to go into the comprehensive package. The second thing is that the evidence and evaluation is also very important to make sure that the tax is go along the way. For example, in case of Thailand, you use the SSB tax almost 10 years already. And I think evaluation has been accompanied along the term, right? So at the end, need to make sure that whether Dr. Pochana said obesity reduced, is sugar consumption is reduced, is it the healthcare expenditure related to the diabetes already reduced? Because it's also important and need to be adjusted over time to make it the product become less affordable. The evidence is still very low, and so it's need to make more room to increase and shift the consumer behavior. And you need a strong design structure, implementation, and evaluations. So at the end, it should go hand in hand in terms of the enforcement and administration, and as I say, other interventions. Thank you very much.
Okay, so let's hear from Professor Leonard. Professor Leonard, please.
Thank you, Maria. So inevitably, I'll be repeating some of the wisdom that the other speakers have already shared. So I'll speak mostly from my perspective in that we do modeling to support policy change in this space. So that brings us to the role of evidence. We've already heard some of the things that evidence alone is not enough, but it's crucial. International evidence is, of course, already available, supporting the effectiveness of taxing foods that we want to have less consumption of. At the same time, has to be recognized, I think that, as Dr. Visarupan also emphasized, that more evidence is needed from real world implementation. Of course, some of the immediate effect of, say, taxing sugary drinks can be quite obvious and relatively easy to measure, such as tooth decay caries in children. So in the UK, for example, there's clear evidence that it has had an impact. Most of the impact for SSB taxes, though, are in the longer run. So we expect a slight reduction in BMI, but that falls away in the general trends because the taxes tend to be quite small, etc. So we need stronger evidence there. Yesterday, I was in a live radio conversation, and after me, a representative from the Beverage Council was interviewed, and he just said that there was no evidence that the taxes work. Now, that's not the case. So I have to emphasize definitely that we do have evidence and accumulating evidence that the taxes work. But where modeling comes in is that, we can't really visualize or bring forward these expected future benefits of the taxes. So, of course, this rolls out. If you prevent youth from smoking, for example, when are you going to see the benefits in terms of your death rates? Well, that's going to be decades from now. So you have to make assumptions based on evidence as to what is likely to happen. That may be convincing, but there are two conditions that especially Gershom and Amos have already mentioned. Was that the first thing, okay, there needs to be a reasonably supportive public. And more crucially, I guess, there need to be local advocates. Someone has to push this. Evidence alone is not enough. It's not going to do it. And then you need policymakers that are receptive to this. So who is the Minister of Health or even Finance who's willing to push this? If you've got those conditions in order, then it's possible that something like modeling could play a role. And that role is to collect the evidence, the international evidence, but especially the local evidence. So policymakers want to see that is relevant for their country. Has it been proven there? What's the evidence? So really incorporating that evidence is very important. Also mentioned before is that, I think by Nisha, that it's a process and that you work together with the policymakers and other stakeholders, although with the industry at arm's length, in the process of sharing and building that, going through that evidence to make sure there's an understanding and an acceptance of the evidence. So that really helps. If you just plonk the report on the table, it's hardly going to do anything. So then the role of modeling could be there when there is that policy window, with all the other evidence and the support, strong support of WHO, which recommends also the World Bank, of course, and UNICEF from their different economic and child health perspectives can also play a role in supporting that. What else was I going to say? Yeah, I think that's where things come in. Then, of course, in reporting the evidence, it's the health benefits. For some parties, those may be important, but tax revenue is another one. So indeed, all countries have, I think mostly all countries have deficits and financial pressures. So definitely for the financial side of things, it's important to know. You might know there that, for example, to the extent that your tax on sugary drinks is effective, it's not only discouraging through the price mechanism, but also through reformulation. So in the UK, which as Gershim, I think, emphasized, was smartly labeled the sugary drinks industry levy. So tax was not mentioned, and it was a tax on industry, not on consumers. Industry responded by reducing the sugar content to this tier tax to just below the next threshold. So that was really good for public health because people didn't have to switch the product while still getting a health benefit because now the sugar content had been reduced on the same product. And you can do that because consumers can get used to less sugary stuff. Compare the sugar content in the United States to that in Europe, for example, much higher in the US. Same is possible in sodium, which is a big issue. It's very difficult to get people to reduce sodium. But if you replace part of the sodium with potassium, then without consumers having to change any behavior, you get major health benefits. It's been shown in randomized controlled trial. So I guess that's that. Other parties might be interested in productivity. So I've also mentioned Dr. Visa-Rupon, a healthier population lives longer, is more productive, so that can help. And I think that's the extent to it. So really tailor the message to the key audience who needs to be convinced, and make sure that you include that using strong local evidence in collaboration with all supporting local partners. Thank you.
Okay, thanks very much for Dr. Charlatan and Professor Lennart. So yes, this is a session that you are looking forward, Q&A. So yeah, we welcome, and if you have any questions, comments, yeah, all the speakers are happy to address your questions. Or I mean, if you want to speak up, yeah, please, or turn on your mic. And you're like, for those that prefer to send your questions to the chat box, yeah, feel free to do so. We don't have any.
And as we wait for people to formulate their questions, we also have richness. We have people from around the world here. So I think I will also open this up to our speakers in case they wanted to either add something or they wanted to direct a question to a colleague. So that is also an option. Otherwise, I'll go back to my list of questions. I have more. This one. All right, in which case I will.
So I just want to ask a question from maybe Dr. Veeraman. So this discussion, today in the morning, we had a discussion of the SSP stakeholders. And one thing that was talked about was that using substitute, to so that you don't have to change the consumer preference, but you reduce the sugar level and, as you mentioned, like potassium level by using substitutes. But they were not in favor of that, saying that that doesn't really change people's tastes, and they will still look for sweetness. So what do you think about that?
Yeah, that's a complex issue, and it's an argument often mentioned. Look, the way I see the evidence currently is that, well, I usually point to an experiment that was done in the Netherlands back in 2013 or so, New England Journal of Medicine, where they took school kids who were drinking sugary drinks and then gave them for half a year a supply of either regular sugary drinks or similar looking, tasting drinks with artificial sweeteners. So for that particular sweetener, anyway, that didn't seem to have an impact on weight. So there was a clear weight gain in the group that had the sugar, and much less weight gain in the group that had the artificial sweetener. So for me, that disproves the argument that people will still crave sugar. So if they don't get it in their drinks, if they're deceived, then they'll find some other way to get the sugars. Apparently, if there is such a mechanism, then it was not complete. So on that count, it seemed that the artificial sweetened beverages were healthier than sugar sweetened beverages. The best advice is still to drink water, because we don't know all there is to know possibly about the non-nutritive sweeteners. Also because, well, first, there are diverse ones of them. Second thing is that we don't really know the longer term consequences. So concerns have been raised based on cross-sectional evidence, but that evidence is rather weak in humans because the reverse causation argument that go there, the people who were on diet drinks some of them may have done that because they had complaints that may have related to diabetes, for example. Then later they still get the diabetes because they were already on the verge. So then the causation might be reversed. And the second thing is that animal studies have sometimes shown adverse effects, but that is typically in doses that are much, much higher than you'd find. You'd have to bring 10 liters or more in humans to get to similar doses. So that's not really realistic. On the other hand, humans live longer than most of the test animals, so who knows what might happen in the future. Currently, so I tend to think that I would personally advocate not including them in the taxes in order to make it easier for industry to do that reformulation and therefore get people off the sugar. But you could equally well argue that for safety's sake, precautionary principle, that you would include them and that would stimulate people towards sugar, the water and other known to be healthier drinks. The argument, I think, for the switch in sodium is actually stronger in the sense that I don't know anything that, historically, when we were running around collecting our food and running after it, the ratio that we had consumed much more potassium compared to sodium. Now we're consuming much more sodium and very too little potassium, so the whole ratio is shifted. So I think in that sense, it's a very safe bet to replace some of that salt.
If I may perhaps ask our colleagues from APHRC, and I see Shukri is also online, because as you said, Leonard, there are some of the people working on this have, from a preventative point of view, precisely because of the evidence, advocate for not allowing the switch to artificial sweeteners while others do, and that we've seen this roll out in real time, in which reformulation sometimes doesn't reduce the sugar level, is just completely swapped out versus those where artificial sugars is also included actually leads to reformulation. So we are seeing different effects. But I will turn to, and Amos, you can come in as well, but either Gershom or Shukri or anyone else who might want to speak. Yes, please, go ahead.
I already shared in the chat that the WHO has a guideline not to use the non-sugar sweetener for the weight control, and since 2023. And so we are kind of recommend country that do not use the NSS as another substitute if possible. And several countries also tax on non-sugar sweetener also. Yes. So just want to share, and I already sent it to the chat.
Madiha? Yes.
Go ahead. Yes.
Yes. Maybe I just saw the participant that we have the chair of Let's Solve Network, Dr. Surasak, and the representative from Fiscal Policy Office in Thailand from Ministry of Finance and the Excise Department, Ministry of Finance. So maybe they can share us about the advocate to form the sodium tax, maybe from Dr. Surasak and maybe from the Fiscal Policy Office. Maybe they can share about the how that they use the evidence from our research to through the inform or through forming the fiscal policy. Yeah, thank you.
Okay,
Over
hi.
to you, Dr. Surasak.
Let me, okay, can you hear me? So we've worked with the Ministry of Finance for 5 years already about implementing of the sodium taxation. We produce evidence that we work with food industry first, try to convince them to reformulate their products voluntarily. So start from 5 years ago, and we focus on the instant noodle and snack. And after 5 years, we monitor the sodium contents of their products, and we found that they can reformulate only the minority of their product. For example, less than 20% of their food have been reformulated to less sodium, less sodium products, because for the popular menus, they will change nothing. So that's why we use this as a basis for mandatory reformulation with taxation. And after we work with we have the team with Thai Health Promotion, Ministry of Finance, Mahidol University, and we formed the team to convince the Ministry of Finance to implement the sodium tax. We have the evidence of it. We show them the database that sodium contents on every product that available in Thai market, and they have all the data, and they set up the threshold of taxation and tiers, 2 or 3 tier, and set tax progressively for in the next 5 to 10 years. But they also they said they will implement the taxation this year, but they need great light from the policy maker, that is Minister of Finance, which is we have the new minister just last week. So we going to convince him to implement this taxation. But anyway, I think there's strong lobbying from the food industry that for the sodium taxation policy. Thank you.
Maybe I forgot. Natapon. Yeah. Natapon from Fiscal Policy Office. Yeah. Thank you.
Yes, Mr. Natapon from the Fiscal Policy Office, Mr. Finance. Anyway, on the sodium tax, we still study, not apply yet. And we thank you for the study and a lot of output that we can use to make social impact be convincing to implement. Anyway, I would like to mention that it's still study, not implemented, and it's still on the working process. It's not a mention a specific date that have to tax. Anyway, on the SSV tax, it has a lot of question that indeed the SSV tax we have collect excise tax for almost 100 years, but on 2017 the tax rate has sugar concern, and before we don't have a sugar concern, but on the 2017 we have, and so on. The effect is very clear that they can make the manufacturer to reduce the sugar in the beverage. I mean, they have reformulate their product, just like tea, carbonated tea, and energy drink has been reducing the sugar. And from this point, the study from this law can help us a lot to mention the effect of the SSV to the NCD. Thank you.
Thank you so much. There was a question in the chat on front of pack labeling. I know, Nisha, you've responded to it, and I also added links from Kenya and Ghana. But perhaps I might turn to the floor just in case either you wanted clarifications or any of you wanted to add to that question on front of pack labeling.
Yes.
Go ahead.
Thank you, the chair. And thank you a lot for the very good presentation from all of you. So my question is relating to the front of pack labelings that Anisha's share, because I understand that there are many types of the front of pack labeling, and traffic light is one among them. So as far as I know that from Colombia or Mexico, so they use like the size with the black and white or something like that, and it is considered like the good, like a better impact rather than other type of the front of pack labeling. So that is the reason for my question is that the governments of Ghana already choose the traffic light. So is there any reason for that, or do you have to provide any evidence to process the government to use that rather than the better one? That is my question. Thank you.
If I may, yes. Nisha will go to you, and then after that, Leonard, if that's okay.
Yeah. So the thing is, this was implemented in Sri Lanka back in 2017, if I'm correct, if I'm not wrong. So I think at the time, these other types of front of this labeling was not available. Other thing is also because it was the first time the government was introducing that, they didn't want to go into highly technical things like neutral labeling, because that would need a lot of kind of testing to be done to make sure the labels are properly done. So they wanted to start off with something simple to build on that. That was one reason, as I understand, that they decided to go with the traffic light labeling at the time.
Leonard?
And that was the main thing I was going to say. So if you want a sophisticated label, then you need the infrastructure to back it up. So you do need the nutrition content knowledge there. You need to have labs to check that it's actually what it says on the package, etc. So it probably takes a number of steps. So that's one. The warning labels are somewhat easier to administer and to check in that sense. So the second consideration, I guess, is what is the understanding of the public. You can generally, in my understanding, warning labels are probably the easiest to understand. But of course, they lack some sophistication because a product may be, well, bad on multiple fronts, or it may be only bad in, well, say, the zero sugar things that then are full of other bad things, full of fat, or the other way around, zero fat, full of sugar is a bad thing. So a more sophisticated system could work with that. So I guess local knowledge of what works is important as well.
And Amos, because I know you've been working on this in particular.
So I raised my hand, mid-air, and I dropped it because Leonard has addressed what I was going to say. So as we all understand, there's no gold standard or global gold standard as to what the front of pack labeling should be. And so as Leonard indicated, context matter. So before these labels come out, there have to be local testing and assessment to see which works best for which situation or setting. And so that's what countries are doing. And so if a country does their testing and it is something different from what another country is doing, there's no problem with that.
And Gershom.
Yeah, just like you said, for our case, indeed, we tested. We tested 3 front of pack labels. But even to come to the 3, we first did extensive consultations. We did a desk review to understand what FOPLs are available. And then we did focus group discussions across the country. We went regionally. We did actually 12 focus group discussions and then narrowed on 3, which we discussed extensively with the technical committee that was producing the front of pack label at Ministry of Health. Now, based on that, we took the 3 labels to population level randomized control trial. And what came out actually emerged as the best was the warning label, a black octagon with the writing high in salt, high in sugar, and high in fat. That's our experience. Yeah, thank you.
Maria, your sound is falling away, I think.
Yes.
Yes, I was just checking if there were questions in the room rather than perhaps my overtaking these. I know I had a question for, as we were talking about this. Yes, so and perhaps this is for Jonathan in particular, because we talked a lot. I think the title was Fiscal Policy or Taxes. We talked a lot on price for reducing competitiveness of unhealthy items. But as you said, there is the other side, which is making healthy items more affordable or creating the incentive. So using that the same price mechanism at the population level to make healthy items more affordable. Could you speak to us a little bit about that?
Yes, in my presentation, I already show you that the subsidy is another size or is a negative tax. And in some country, in the term of populations, European country, some country reduce the rate or exempt the rate, special for the healthy products like healthy food. And example is in the presentation. And in some country, use the food voucher to subsidy to the poor and also the local people in certain group that need vulnerable group that need to be support. And this also can be linked to someone mentioned earmark, that you get the revenue from the tax and then you use the revenue to do something like promote in terms of healthy diet. That can also make the food environment become better. And the other thing that I want to mention is that if you want to tax based on sugar content or the sodium content, food labeling also quite useful for the tax, because of the when you tax based on sugar or based on sodium, you need to validate it. And only the tax administration to control or monitor on this may not enough. And if the food or labeling is mandatory and also control and monitor through the FDA or Ministry of Health, that would be also helpful and strong. And that is why multi-sectoral and comprehensive package to do this is very important.
Thank you so much. And just to say, as IDRC, we are very intrigued by that because, as we saw, we see a lot of discourse around earmarking and use for the health promotion levies for either financing health or school meals has recently been in the conversation. But as you said, linking that earmarking to accessibility and affordability of certain food items or for certain populations would be very interesting to explore at scale. I perhaps had a question for Gershom, and others might want to add in as well, is because we've talked very much about the Kenyan experience, but I think there's a lot to be said for what a country does in its national policy and how that might influence regional policy. Could you speak to us a little bit about that, Gershom, if you've done some work on that and what Kenyan's experience might help influence in the region in East Africa?
Yeah, thank you. I'll speak about this, and then maybe Shukri could add something on that. She's in the call. We understand the fact that our borders are very porous. People move from one country to another, and therefore having a good tax in one country may not necessarily control the flow of unhealthy foods from the neighboring country. So having a regional tax would be a good thing, and especially where you have regional blocks like the East African Community, there's a potential to actually have a regional policy. I'll give you an example of what is in East Africa. There's a body at East African level that has a policy looking at labeling of foods. And they have actually guidelines on how regionally foods can be labeled. And this has been happening with the back of pack labeling. So when recently Kenya developed the nutrient profile model, and quickly this body is trying to work together to see how this could be adopted for a regional guideline. The same could apply to taxes as well. So we, with support from IDRC, we have recently got a grant that is working on, a grant by IDRC supporting us to do these regional engagements. We have started by Uganda and Tanzania that are neighboring Kenya to look at how we can harmonize the nutrient profile model and also the front of label pack for the three countries. And this is going well because they are basically adopting tools to try and see how they can test. For instance, Uganda said we cannot start by testing three front of pack labels because already the cultural context and other aspects are the same in the region. They have gone straight away to look at the front of pack label, the level of understanding that people have for a warning label in Uganda, for instance. And the protocols for testing these we have shared with the two countries. And recently we had a regional engagement where we had the three countries represented here in Kenya. We had Ministry of Health invited from Uganda, and then the Bureau of, Uganda and Tanzania, and the Bureau of Standards from the three countries. And it was a very good outcome. It's had a very good outcome where they are looking forward to really having advocacy efforts, policy directions, where we can have regional policies other than this thing. But then maybe the learning here is that what we are doing in Kenya is helping a lot in influencing the policy efforts in the region. Thank you. Shukri, I don't know if you want to add something. Shukri is in the call.
Thank you, Gashim. Yeah, I hope you can hear me. So I think you've covered most of it, and maybe just to add that at the East Africa community level now, there is ongoing discussion in the development. There's a draft front of pack labeling that will be used within the East Africa community setting. So we're working with them in terms of improving what they had in there. And also we are in discussions around talking about nutrient profiling, harmonizing or getting a standard nutrient profile model that can work across, because they started with the front of pack without having a nutrient profile level that will sort of is needed. So we're also in discussions looking at how to harmonize some of the nutrient profiles that are out there. Because Kenya has already developed one, Tanzania and Uganda are already in development. So we're just trying to see how we can have a harmonized one that can be used across East Africa, because they do understand that food travels around the borders. Thank you.
Can I
Excellent.
ask
Yes,
questions?
go
That,
ahead.
the food tax based on nutrient profile model is already implemented in Kenya, or is about to propose? I know that there is a nutrient profile model, but not sure about the tax that based on nutrient profile model. Can you confirm that?
Gashi, you want to take that? I can take that.
Go ahead, Shukri.
Yeah, so we have a nutrient profile model that has been completed. And so based on that nutrient profile model, there are different policies that are now being developed. So front of pack is one of them. So it's nutrient profile model is just the document that now classifies these foods and shows which nutrients of concern that are being looked into Kenya. So we have salt, sugar, fat, saturated fat. There's also ongoing talks to add non-sugar sweeteners as well as trans fatty acids. The reason it wasn't added in the first draft is that it was there are other regulations that were used to talk about them, so they didn't see the need to have it included. But from recent discussions we've had, there's discussion to put them all in that nutrient profile model.
And is there been used for the tax policy already?
So that's what is being used as the basis for the tax policies. So now that it's completed, but Kashim, you want to say a bit more about that?
Yeah, so yes, we're discussing where, as I mentioned earlier, we are drafting the tax policy now. And one of the things we are doing is to ensure that we use the thresholds provided by the nutrient profile model to classify the foods. But you raised an important issue which came up in one of our meetings as well, that if you just only classify using the nutrient profile model, it could classify majority of the foods as unhealthy and could have a cost of living issue. But then one thing we discussed is we can look at the categories. We can first, we are currently doing an analysis to look at what proportion of foods by categories are classified as unhealthy by the nutrient profile model. Then based on that, we could decide to select categories that have majority of the foods as unhealthy, and then tax them. So the discussions are underway. We engaged the National Treasury. They were very excited to look at the nutrient profile model because they said they have already been having the idea of taxing unhealthy foods higher, but they didn't have a reference document to guide them. So basically, they broadly classified their foods as luxury goods, which include even bottled water. So kind of they think now with the nutrient profile model, they could do the segregation of the taxation bands based on the nutrient profile model. So kind of, yes, we will use the nutrient profile model as a guide as well for the taxation. Yeah, thanks.
Thank you. Actually, this segues very nicely into Nisha's question. I know this has come up in discussions before, to the extent that when we're talking about taxation and labeling, how much does this cover informal products or the informal market? And I know that is different across different countries. Perhaps, Shukri, I know we're almost down to the last minute, but I will turn to Shukri because you've led a lot of this work on the nutrient profile model. Do you have could you share how that's been addressed or looked at in your experience?
So thank you, Medina, for that question. There's been a lot of discussion around the informal food environment and how to proceed with that. But as the committee, they decided that let's first concentrate on the packaged foods. But I think what is going on is that there'll be more discussion around how to now regulate that other informal sector, because majority of people are having foods from informal sectors, and that is not actually covered within the confines of this work that we're doing. But there is an acknowledgement that that also needs to be done. But we'd also would like to learn more about other countries and how they've handled that. Would be also good for us to see how to also proceed in our setting.
So with that, I think we might have to close, but that's a good point. I think that has come up in the last contributions, in that there is a lot to do, but we might have to prioritize on starting from perhaps the most urgent issues and then moving from there to other parts, other challenges that we continue to see.
Okay. So yeah, I mean, we all know that like we still want to discuss more, but unfortunately, the time is up. But like you can still keeping our conversations going. With this event, I would like to thank all of our speakers and participants for such an engaging and insightful discussion today. We hope their perspectives shared by our participants, speakers on fiscal levers in food system and nutrition have been valuable for your work and thinking. And before we conclude, I just would like to highlight that this is just the beginning of our conversation. The next webinar in the series, Taxing Food Feeding Change, we will have second episode, and it's titled The Broker Lens on Fiscal Levers in Food Systems and Nutrition. And the next episode is scheduled on February next year, with the firm date to be announced very soon to all of you. We warmly invite you to join us as continue to explore more on these critical issues from news perspective. On behalf of the organizers, thank you once again for your active participation, and we look forward to seeing you all in our next webinar. Thank you.